Sibling relationships represent some of the longest-lasting familial bonds individuals typically maintain throughout their lives. Despite the potential for deep affection and lifelong support, these relationships can also harbor conflict, ultimately leading to what is known as sibling estrangement. Defined by emotional distancing, sibling estrangement occurs when the relationship becomes so fraught with issues that it deteriorates, leading to minimal or no contact in adulthood. Despite the potential for deep affection and lifelong support, these relationships can also harbor conflict, ultimately leading to what is known as sibling estrangement. Defined by emotional distancing, sibling estrangement occurs when the relationship becomes so fraught with issues that it deteriorates, leading to minimal or no contact in adulthood. This phenomenon, while not frequently discussed in mainstream discourse, is more common than one might expect, with cases such as those of Britain's Prince William and Prince Harry highlighting its occurrence, even in high-profile families. The causes of sibling estrangement are multifaceted, ranging from childhood experiences of rivalry and perceived favoritism to adult differences in personality and the presence of mental health issues. Indeed, research indicates that significant predictors of estrangement include historical abuse, toxicity in interactions, and differing life trajectories that widen the emotional and physical gap between siblings. Given the profound impact such estrangement can have on emotional well-being, often evoking feelings of grief, shame, and regret, it is crucial to explore strategies for either reconciliation or peaceful acceptance. This summary reviews the psychological literature on sibling estrangement, examines its common causes and psychological impacts, and discusses possible approaches for those seeking to mend or manage these complex relationships. By understanding the dynamics at play and considering the potential for healing, individuals can make informed decisions about the future of their familial ties. Sibling estrangement, the phenomenon where brothers or sisters grow apart to the point of minimal or no contact, can stem from a complex interplay of factors. Understanding these causes is crucial for addressing and reconciling these relationships. The significant causes of sibling estrangement include historical abuse and toxic behaviors. Instances of physical, emotional, or sexual abuse that occurred during childhood or adulthood can lead to long-lasting scars, resulting in estrangement. Siblings who engage in toxic behaviors such as manipulation, hostility, or consistent negativity contribute heavily to relationship breakdowns. Personality clashes and mental health issues. Differences in personalities that might have been manageable during childhood can become more pronounced and problematic in adulthood, particularly if compounded by mental health issues such as narcissism or bipolar disorder. Such conditions can exacerbate misunderstandings and conflict between siblings. Childhood rivalry and family dynamics. Jealousy and competition that start in childhood can persist into adulthood, mainly if fueled by perceived parental favoritism or differential treatment. These feelings can evolve into deep-seated resentment, undermining the sibling bond. Life choices and values. As siblings grow and develop their own identities, divergences in life choices, values, and beliefs can create significant rifts. These differences can be particularly challenging when they conflict with each other's core values or life paths. Physical and emotional distance. Sometimes simply growing apart due to geographical distance or different life stages can lead to emotional distancing. When siblings live far apart or go through various life experiences, like marriage, children, or careers, it can be challenging to maintain a close relationship. Communication breakdowns. Inadequate communication or misunderstanding can lead to unresolved conflicts and resentment. A lack of effective communication skills can prevent siblings from resolving past hurts and misunderstandings, further driving the wedge between them. Envy and competition. Continuing from childhood, envy and competition can persist into adulthood over achievements, relationships, or financial status. This can breed resentment and discontent, particularly if one sibling perceives themselves as less successful or favored. These causes of sibling estrangement highlight the need for a nuanced understanding of family dynamics and personal histories. Addressing these issues often requires honest reflection, communication, and sometimes professional guidance to heal old wounds and rebuild relationships if desired. Sibling estrangement can have profound and varied psychological impacts on individuals, affecting their emotional well-being and relationships with others. Understanding these effects is crucial for those experiencing estrangement and professionals seeking support. Here are the key impacts of sibling estrangement. Emotional pain and grief. Losing a relationship with a sibling often triggers a grieving process, similar to other significant losses. Individuals may experience sadness, anger, and a profound sense of loss. The grief can be complicated by the ongoing nature of the relationship, where reunions or reconciliations may still be possible, yet remain unrealized. Feelings of guilt and shame. There can be significant guilt associated with either the decision to estrange oneself from a sibling or from contributing factors to the estrangement. Similarly, shame may arise from societal expectations that family relationships should always be preserved and harmonious, leading individuals to feel like failures when they cannot maintain these bonds. Impact on mental health. Estrangement can lead to or exacerbate mental health issues such as depression, anxiety, and stress. The emotional turmoil and ongoing stress of a fractured relationship can have long-term effects on an individual's mental health and overall well-being. Effects on other family relationships. Sibling estrangement often does not occur in isolation. It can affect relationships with other family members, including parents and other siblings, who may be drawn into the conflict or forced to take sides. This can lead to further familial discord and estrangement within the family unit. Identity and self-perception. Siblings play a significant role in shaping one's identity. Estrangement can lead to questions about one's past, family narrative, and role within the family. Individuals might reassess their childhood and family dynamics, which can alter their perception of themselves and their developmental history. Social and relational skills. Siblings often provide a context for developing social skills and learning how to navigate relationships. Estrangement might limit these opportunities, affecting an individual's ability to form and maintain other relationships outside the family. Regret and missed opportunities. Over time, estranged siblings might miss important life events such as weddings, birthdays, or funerals, leading to feelings of regret and missed opportunities for reconciliation and family bonding. The impact of sibling estrangement is profound and multifaceted, affecting individuals' emotional, social, and psychological health. Recognizing and addressing these impacts through supportive counseling, therapy, or mediated family discussions can be critical in helping individuals cope with the consequences of estrangement. Reconciling with an estranged sibling can be a challenging yet rewarding process. For those considering reconnection, it is crucial to approach reconciliation thoughtfully and strategically to increase the chances of restoring a healthy relationship. Here are critical strategies for reconciling with an estranged sibling. Assess the situation and your feelings. Reflect on the reasons behind the estrangement and your current feelings. Understand what has changed since the estrangement began and evaluate whether reconciliation is something you genuinely desire or is feasible considering the circumstances. Prepare emotionally. Reconciliation can evoke strong emotions. Before reaching out, ensure you have managed any residual anger or resentment. This might involve personal reflection, therapy, or discussing your feelings with a trusted confidant to approach the reconciliation calmly and openly. Initiate contact thoughtfully. When you reach out, choose your communication method carefully: a letter, email, or phone call. Start with something non-confrontational, expressing your wish to reconnect and perhaps acknowledging the passage of time and missed experiences. Use non-accusatory language. During conversations, focus on expressing your feelings and experiences without blaming. Use I statements to convey how specific actions made you feel, rather than accusing the sibling of having specific intentions. Listen to their side of the story. Listen actively to your sibling's perspective. They might have a different view of what led to the estrangement. Understanding their feelings and thoughts is crucial for a balanced reconciliation. Set realistic expectations. Recognize that reconciliation is a process, not a single event. It may require multiple conversations and a gradual rebuilding of trust. Set realistic expectations about the time and effort required to restore the relationship. Establish boundaries. As you navigate rebuilding the relationship, Clearly define boundaries that respect both parties' comfort levels. These might involve limits on topics of conversation, frequency of contact, or interaction methods to ensure that the relationship develops in a healthy, sustainable way. Be patient and give space. Allow the relationship to grow comfortably for both of you. Avoid rushing intimacy or reconciliation. Instead, let it evolve naturally. Giving each other space can help prevent overwhelming feelings and respect each individual's healing process. Consider professional help. In cases where estrangement stems from deep-rooted issues or communication proves particularly challenging, consider seeking help from a mediator or therapist. Professional guidance can facilitate more effective communication and resolve unresolved issues. These strategies can pave the way for a thoughtful and meaningful reconciliation. Still, it is essential to remember that success depends on the willingness and readiness of both parties to mend the relationship. It is essential to recognize that the journey toward reconciliation or acceptance is profoundly personal and varies significantly from one individual to another. Sibling relationships are complex and carry a unique blend of shared history, emotional investment, and familial ties. The decision to reconcile with an estranged sibling or to accept the estrangement should be made with thoughtful consideration of personal well-being and the potential impact on one's life. Reconciliation is not always possible or desirable, especially in cases where the relationship has been severely toxic or abusive. In such situations, it might be healthier to maintain distance, focusing instead on personal healing and growth. Acknowledging and accepting estrangement can sometimes lead to a more peaceful existence, free from ongoing conflict and pain. However, for those who decide to pursue reconciliation, it is essential to approach the process with patience, openness, and realistic expectations. The strategies discussed, assessing personal feelings, initiating contact thoughtfully, listening actively, and setting clear boundaries, can serve as a foundation for slowly rebuilding trust and understanding. Whether one chooses the path of reconciliation or acceptance, it is crucial to seek support when needed. This can include talking to trusted friends, engaging with a therapist, or joining support groups for those experiencing similar challenges. Navigating sibling estrangement is a significant emotional undertaking. No one should face it alone. In either scenario, finding a resolution that promotes personal well-being and peace is the most important outcome. As such, individuals must make choices that best align with their emotional and mental health needs, ensuring that their actions contribute positively to their life's narrative and personal journey.